Are we live?
Yes, we're live.
All right. So welcome everybody. We're here at Advanced Orthopedics in Northwest Houston, and we're going to give a little bit of a talk today about regenerative orthopedics. And the main goal today is to give people options. During this time, people may not want to undergo invasive procedures or go into hospitals or other kind of facilities, but may rather opt for seeing their physicians either online through telemedicine and then having procedures performed in an office type setting. Also, some patients who are already scheduled or are ready to have more invasive surgeries may want to delay these surgeries, but they're still in pain or they have, significant problems with mobility. So here's an option to do something about it while you're waiting for your procedure to be scheduled and performed. We've been doing regenerative orthopedics for a number of years at Advanced Orthopedics. We've been doing this either to delay surgery or even sometimes as a replacement to surgery or even other types of injections such as cortisone injections. So I'm really happy that you're all here to listen to this talk. Obviously the treatment goals or obviously surgery is not for everyone. There's risk factors involved in surgery. People can have obesity, heart disease, diabetes, or there may be a risk of infection following surgery. And some people may want to opt for non-surgical treatment. Also, if you are unable to take some time off, you have insufficient help at home, there may be also some economic reasons that you may want to avoid surgery. And this is where I feel that a good option often is non-operative regenerative treatments. Before I talk about non-operative treatments, though, I want to talk about ultrasound. So ultrasound imaging is a way to look inside the body that's non-invasive. Other forms of imaging include X-rays and fluoroscopy. Unfortunately, X-rays involve radiation, and then the advantage of using ultrasound that there is no radiation. So we've been routinely performing ultrasound here at Advanced since 2009, and we have performed several thousands of ultrasound-guided procedure. So again, the main advantage of ultrasound is the ability to visualize lesions and also the accurate placement of injection. So if we're going to give an injection, we know exactly where we're going to put it. We don't have to inject an area that doesn't need an injection. And also it's more often less painful than a standard injection because we're able to direct our needle directly where we want it the first time without having to fiddle around. Here's an example of a torn medial meniscus. So what we can see is right over here, you can see the extruded meniscus. This here shows the bone, and this is swelling above the meniscus. So meniscus is the knee cartilage that often tears. It's associated either with injuries or even with arthritis. So that here's an example of that. Next example is an example of a knee effusion. So this is fluid within a knee. If somebody tells you that you've got water on your knee, essentially it's this black area over here that is the fluid that's in the knee joint. So you can actually see the needle being placed inside the joint, and we can often remove the fluid that's already in the joint, as well as the small little cartilage particles that are inside, and then inject whatever we need to inject to make the knee feel better. So essentially, that's ultrasound. One thing we've done a lot of over the past 15 years is platelet-rich plasma treatments, or PRP. You're often going to hear about PRP. Platelet-rich plasma is a product that's derived from your own blood, and the blood is drawn from a vein, just like when you go to the lab, and then the blood is spun in a special centrifuge and then transferred to a syringe. How it works. So when you inject the platelets using a needle into tissue, just like if you would for a cortisone shot, the platelets arrive to the damaged area, they burst open, releasing growth factors, and then these growth factors will attract stem cells to the damaged tissue. And essentially, the tissue will be repaired, and new collagen fibers will be laid, kickstarting the formation of new healthy tissue. The repair process after PRP can take anywhere from initially 6 weeks, but can continue for 3 to 12 months, depending on several factors. PRP is indicated for inflammation, bursitis, tendonitis, torn tendons, partial rotator cuff tears, as well as arthritis or osteoarthritis. Here's an example. We had a 34-year-old female triathlete who was having pain for 2 years at both hips. She was treated with PRP, and she had a single injection at both hips in her trochanteric bursa. She was able to eventually resume normal activity and participated in a triathlon about 3 months later and did really, really well. The next innovation that we are pioneering here at Advanced is, to me, a progression or an improvement on PRP. This one is called PRF. PRF essentially is platelet-rich fibrin, so something that's very similar to PRP, which is platelet-rich plasma. Platelet-rich fibrin includes the presence of platelets, which are over here, and then there's the presence also of white blood cells. So we have the full complement of white blood cells, including circulating stem cells. And finally, we have a fibrin mesh, which is the image on the top. And the fibrin mesh, to me, makes a difference. Because we inject fibrin, which is a normal product of blood coagulation, the cells seem to have a scaffold to hold on to, seem to stay in place better than with plain PRP, and also seem to be more viable, as demonstrated by several recent studies. By viability, I mean the cells are able to stay alive for a longer period of time in the tissue and effect a repair process. So platelet-rich fibrin is derived from your own blood. So it's a living material. These cells are alive. It's very compatible, meaning that it will adapt to the tissue that you inject it into without causing a reaction. It's very easy to produce, and it's relatively fast also, requiring only about a 5-minute spin. So typically, patients would come into the office, they get their blood drawn, the blood is placed into a centrifuge, meaning it's being spun. While it's being spun, we're numbing the area really well so that the injection will not cause any pain. And then once the product is available, then it can be delivered to whichever body part we need to use it. We've had 0 infections, we haven't had any kind of rejections or any kind of complications with the platelet-rich fibrin, having used it for over 4 years now. The PRF can be combined with hyaluronic acid for osteoarthritis, meaning that we can inject hyaluronic acid into the joint, followed by platelet-rich fibrin, and we've had really good success at decreasing pain and disability for arthritis when we do that. Here's an example of the PRF. So at the bottom image, you can see us simply drawing a little bit of blood into a normal test tube and then placing the test tube in the centrifuge. And we can use as many as we want. Typically, we'll use 2 tubes per application. If we're using a really small, if we're injecting, a small body part, we'll use only 1 tube. And if we're injecting multiple areas, which we can do, so if we're doing, say, a shoulder and a knee, we can use up to 12 tubes, which we've never done. But we can go up typically to 4 and even to 6 if it's really required. Here's an example of the centrifuge. So it's a special centrifuge but it's simple enough. It's not very complicated. We just press a button, we get the spin, it stops automatically, and then we draw the supernatant, which is what floats to the top to produce the product. So again, when can we use this? Definitely for knees and shoulders, we've had really good success. We treat a lot of our meniscal tears non-operatively now with PRF injections, as long as there are no mechanical symptoms, meaning that the knee is not locking, popping, or that we don't feel that the meniscus is displaced from its original location. We can use it for partial ACL tears, for acute ligament injuries, acute tendon injuries, as long as, again, they're partial. We use it for patellar tendon injuries. We also use it for quadriceps tendon injuries. We can use it for articular cartilage injuries also, again, as long as there is no loose bodies within the joint. And lastly, for arthritis. With the shoulder, we have experience injecting full thickness rotator cuff tears. Now, it won't repair the rotator cuff, but for some patients, it will take away the pain and improve the mobility of the rotator cuff. So we've used it for full thickness tears. We've used it for partial thickness tears of the rotator cuff. We've used it for partial biceps injuries, labral injuries, and again, for shoulder arthritis, we've had very good success when combining it with a hyaluronic acid injections. Obviously, we treat many other body parts, whether it's the elbow, the hand, the wrist, the foot, the ankle, the hip. We treat many other body parts with the PRF injections. When we want to really have stem cells, or when we want a large quantity of stem cells, then we'll do a bone marrow aspirate. A bone marrow aspirate concentrate means that we get live stem cells from your bone marrow. They're separated from the rest of the marrow tissue that we harvest, and then those can be injected into the injured tissue. Here's an example of bone marrow that's been aspirated. Here's an example of us putting a needle into the bone. So it's a lot scarier than it really is. We typically do a really good local anesthetic. So essentially putting a needle into the bone is not really painful. And then the blood or the bone marrow can be aspirated without difficulty. We place it into a special angel centrifuge, which will separate out the bone marrow concentrate from the rest of the other aspirate. There's a special electronic eye that will help us determine when it's the right time for separation, and it's all done automatically through this machine. The product stays sterile throughout because it's a closed system. Lastly, I'd like to talk about lipogems. Lipogems has been a real game changer for me. It is a very powerful regenerative treatment. Lipogems was developed several years ago in Italy, and we were lucky to be one of the first clinics in the country to use lipogems about 4.5 years ago. Lipogems essentially is adipose tissue technology, meaning that we use fat to produce a product that will enhance or help tissues heal. So lipogems essentially is regenerative tissue. We can compare it to growing grass, where to grow grass you need cells, you need a scaffold, and you need fertilizer. And this is exactly what lipogems delivers. Tissue needs, or the needs for tissue regeneration are the following. You need cells, you need a scaffold, and you need growth factors, as well as a blood supply. If you have all three of these and the blood supply, you have more chance of getting a strong tissue regeneration. So lipogems delivers all three of these. It delivers cells, it delivers a scaffold, and it delivers growth factors. Here's an example of fat cells or adipose cells as a cluster. And what we're doing with lipogems is we're developing tissue clusters that can then be injected into the tissue. Here's another example. This is called a microenvironment. So what we try to do is we try to grab the cells in their natural environment. We try not to separate them from their natural environment, because we found that if cells stay close to their origin, they're more likely to live and then to multiply and help with tissue healing. So you can see here what we have on top is the blood vessels with little cells right on the blood vessels, and these are called the pericytes, which are cells that are on top of the capillaries and that can migrate into the blood vessels when needed. So sometimes when we sustain an injury and our body needs stem cells, these cells actually are recruited from fat and will go into your circulation and go and land in whatever areas need repair. So what we're doing here is we're taking the cells out with fat cells, with their capillaries, and with the collagen scaffold to allow the cells to feel that they're in a normal environment and to allow them to be nourished by their surrounding tissue so that they can do their repair job and we can keep as many of them living as possible. So the benefits of fatty tissue or adipose tissue is that it's relatively easy to harvest. We simply do a mini liposuction right here in the office. You don't have to go to a surgery center or to a hospital. We can do it under local anesthetic, meaning that you don't have to have anything IV, so it makes it really safe. And we typically will numb you really well. So although it may sometimes be a little bit uncomfortable, for most patients, it's really not painful. The other advantage is that we can take as much as we need. So if you need to treat 2, 3, 4, 5 joints on the same day, it can be done on the same day. So say if you had arthritis in both knees and a shoulder, we could do both knees and a shoulder on the same day, which wouldn't be possible if we did any other kind of treatments. If you had to have surgery, then you would just have it on one day, on one knee, and then you'd have to come back for surgery on the other knee, and then you'd have to come back a third time for surgery on your shoulder. The advantage of using lipogems is that you can do all these joints on the same day, and we've done, on certain occasions, we've done multiple joints, including fingers and thumb arthritis and elbows and ankles, all on the same day, without having any complications such as infection or blood clots or even anything. The advantage of using fat also is that the quality of the cells are maintained during aging, meaning that the cells are still relatively young compared to cells in your circulation or cells that are in your bone marrow. And that's really good for people that are in their late 70s and even sometimes in their 80s, where the quality of the cells is still good enough that we get a good result even in patients at an advanced age. The other advantage is for most of us, we can spare a little fat. You know, that hasn't been a problem. People are happy to donate as much as they can give. Although obviously we're not doing this for cosmetic reasons, and we haven't had any real problem with cosmesis, meaning that your appearance essentially doesn't change. The fat is harvested most of the time from your lower belly, under the belly button. But if for any reason you've got scar tissue there, or you don't have a whole lot of fat, we can always go to the back and get it from the flanks or the area that's just above the buttocks. So here's the process. The process is really simple. What we do is we will harvest the fat. We resize the fat by pushing the fat through a little filter over here, and then the fat will be resized into little clusters, and then eventually we'll wash the fat with normal saline, and then the junk will go out through into this area here, and then the good fat cells are aspirated into a separate syringe over here. So it's a pretty simple process. It's all contained. The system is all contained, so the risk of infection is virtually zero because everything is in a closed system. It's never exposed to the air. It's never exposed to the people who are manipulating it. Once it's ready to be given, then it's simply injected. And you can see here on the image, you can see that it actually looks like a little bit of a paste. We're pushing it through a really thin needle. So it'll go through a 25 gauge needle, which is a really thin needle. So we don't have to use humongous needles to inject this product. And it comes into multiple syringes. We can transfer those into we can transfer the product into smaller syringes if we need to inject very small body parts. Okay. So Lipogems is FDA approved. It's indicated for lipofilling. Lipofilling means that any area that's deficient, any area of tissue that needs to be rebuilt can be treated with Lipogems. Again, the beauty of Lipogems is that it is a kind of a paste. So once it's injected into the tissue, it tends to fill through the scaffold of the tissue, and it tends to stay in place and not move around, which is really good. So it can be injected for rotator cuff tears, for tendon injuries, for patellar tendons, quadriceps tendons. It can be injected into Achilles tendons. We've had really good success with feet injuries and other conditions. So that's Lipogems. Again, it's the use of adipose tissue to fill musculoskeletal soft tissue defects and pathology as a primary treatment, or for scaffolding, replacing or supplementing the patient's tissue, which can assist in cushioning or support. So again, when can Lipogems be used? I think Lipogems is really indicated in our athletic population because it's very, very potent. It heals very quickly. So again, an athlete that may not want to go into surgery and be off from his sport for 6, 8, or 12 weeks may elect to use Lipogems. So again, we use it for meniscus tears. We use it for biologic treatment of partial ACL tears. So I'll show you an example later on. We also use it for ligament injuries, tendon injuries, cartilage injuries, and also for knee osteoarthritis, where it's injected intra-articularly directly into the knee. We use it also for shoulder pathology, rotator cuff tears, biceps tendon injuries, labral injuries, arthritis. We've used it also for hip bursitis, tendonitis, abductor tendon tears. We've used it for hip osteoarthritis with good results. We've also used it for foot injuries, Achilles tendon, again, peroneal tendon injuries, tibial tendon injuries, metatarsal arthritis, ankle osteoarthritis, again, for many foot and ankle conditions, plantar fasciitis also, and we've injected for hand injuries, and so on. So here's another example of conditions that can be treated. So that was lipogems. So now what I'd like to talk about are delivery systems. So, most of the time, what we do is we use ultrasound, we numb the area, and then we use needles using ultrasound guidance to deliver the stem cells or the adipose tissue or the PRF to the locations that need to be treated. Sometimes ultrasound is not good enough to see inside the joint. Sometimes the pathologies are deep inside the joint, and we can't use ultrasound. So an alternative to ultrasound is to use in-office arthroscopy. In-office arthroscopy is similar to arthroscopy in surgery or in the operating room. The difference is we use a very small arthroscope. The very small arthroscope essentially is a device that's just like a needle. It's a 2 millimeter needle that has a lens and a light source at the tip. And that allows us to look inside the joint. Here's an example of a torn medial meniscus. This is a degenerative meniscal tear. So the advantage here is we can see the meniscus and we can inject through the arthroscope or through a separate needle lipogems into the tissue. Here's an example of mild osteoarthritis. Again, here we can diagnose the osteoarthritis using the MyEye arthroscope, and then we can inject whatever product we want through the arthroscope. So here's an advantage of a very minimal lesion, which typically wouldn't be seen on X-ray, that we can diagnose and treat. Here's an example of advanced osteoarthritis. So here we're looking at the arthritis, and we're able here to stage you. So we know exactly where you are at in terms of the evolution of the pathology, and then we can treat you with a biologic injection that you need. Here's an example of a partial ACL tear. Again, what we can do here is if there are still remaining fibers between the tibia and the femur, we can sometimes inject those with biologic products such as lipogems or such as bone marrow concentrate, and hopefully help the remaining tissue mend. Here's an example of shoulder osteoarthritis. Again, you can see this using the MyEye, and you can see the areas of bare bone. This is one area, and this is the other corresponding area. And those areas, again, of bare bone can be treated through the injection of our biologic products. Here's a case report. This is a patient of mine that's been a patient for many, many years. She required a shoulder replacement, which was done for her. Because of poor tissue, she ended up having a reversed shoulder replacement. However, 18 months after, however, 3 months after having had her shoulder replacement, she found out that I was doing lipogems, and she said, "Why don't you do lipogems on my other shoulder?" And I agreed to do it, although I was skeptical because I was in the early phase of using lipogems, and I wasn't sure if it was going to work for her, considering she had had a really good result with the reverse shoulder replacement. But I went ahead and did lipogems on her left shoulder, and about 18 months later, she had about the same result. She had an excellent result with both shoulders. She was really happy with pain relief on her left shoulder, as well as she regained most of the range of motion. So range of motion at both shoulders were very, very comparable. And I was really excited about the result with her, and she still maintains a good range of motion. We've also injected other body parts for her with lipogems, so we went back for secondary procedures. We're able to harvest again from the same location below her abdomen, and we're able to give her some good pain relief with respect to her, I think it was a knee and a hip. A second case report here is we have a competitive female swimmer who was told that she could not have her rotator cuff repaired. It seemed that it was a very severe tear. She had seen many surgeons in the medical center who told her that they weren't very encouraged with her being able to return to competitive swimming. So we did lipogems in her shoulder. We injected some into all the different tendons, whether they were torn or where they were still attached. And you can see here the multiple areas that we injected. We injected her teres minor, we injected her infraspinatus, her supraspinatus, her biceps tendon, her subscapularis tendon, as well as the shoulder joint itself. So we injected a total of 13 cc's of lipogems throughout the different tissues. And she was really happy. I mean, she was so happy that she went back to senior national swim meet in 2017, and she was able to get a total of 5 medals. She also had additional boosters using PRP, and eventually went to the 2019 meeting, and I think she got 7 medals in that one, if I'm correct, maybe more medals. But a really happy candidate, as you can see on the picture. So that's pretty much what we do here at Advanced. I think that we're really cutting edge with respect to regenerative medicine. We've been doing it for a long time. But also, I think because we're orthopedic surgeons, we do it responsibly. There are some cases where patients will come and see us and want regenerative treatment, and we try to be realistic, meaning that if we feel that regenerative treatment is not adequate for them for whatever reason, I mean, their conditions may be very advanced, or there may be other factors, and we may tell them, hey, we think that surgery might be a better indication for you, or might be a better treatment for you, or try arthroscopy, or whatever it is. So I feel that because we're orthopedic surgeons, we have a larger armamentarium of treatments, and we're going to try to tailor the treatments to what you want to have, but also to what's realistic, and try not to guide you down a path where we may feel that regenerative treatment may not be effective for you, because not everything works for everybody. So that's where I think we have an advantage compared to people who may not be doing surgeries. Although there's a lot of great people that do these regenerative procedures throughout the city and do them very responsibly. So that's all I had to say for today. I just want to make sure that you guys are all being safe, that you're maintaining proper social distancing. And the other thing is concerning COVID. I feel that if you're going to have a procedure done, even in our office, it's a good idea to be COVID tested before. We want to make sure you're healthy. If you are a carrier, you have antibodies or whatever, sometimes we'd like to delay any kind of procedure to make sure that you're still 100% healthy, that your immune system is not going to be taxed with a procedure in addition to having been challenged with COVID. So it's always a good idea to get tested if you feel that you're going to need a procedure. The other thing I want to mention is that we have telemedicine. You don't necessarily have to come to the office. If you need to come to the office, then you can just come for the procedure straight and not have to come in for a prior consultation and then come in for the procedure. So that's all I have to say. Now I'm going to answer questions. I think several patients have asked questions, so I'm ready to answer questions.
Awesome. All right, so question number 1 we have from Jack. He asks, can stem cell therapy help neuropathy, not related to diabetes or any other disease?
So again, I feel that neuropathy is still what I consider experimental. I personally don't have a whole lot of experience with it, although I've done several patients, and I've done neuropathy treatments with bone marrow concentrate, but I've also done them with lipogems, and I've had good results with both on the few patients that we've done. So we haven't done many, but the few that we've done, we've had good results, especially in the lower extremities, where I had a patient who had neuropathy from a chemotherapy, and he had the lipogems, and I saw him a short while after, and he was like 85% better. So really happy with that.
And then, are there any studies on these procedures, and why are insurance companies slower to pay for these procedures?
So this is relatively new technology. The technology it has been, especially lipogems, it's been available in the United States only for about 4.5 years. We're going to maybe come on 5 years in September. So whenever you have a new technology, it can be FDA approved, and FDA will approve it for not for efficacy necessarily, but at least for safety. And then clinical studies have to be performed. Now, the clinical studies that need to be performed are what we call randomized clinical trials. And these are typically done by universities and typically can take anywhere from 2 to 3 to 4 years from the inception of the study until the final results. As long as these studies have not been published, this procedure cannot really be brought to Medicare for reimbursement. Once the studies will have been published, then the company can take it to Medicare and they can get it approved. Once it's Medicare approved, then it's more likely to be covered by your private insurers. Private insurers typically don't cover for things that are not Medicare approved for payment. So we're still maybe a few years down, but it would be really great if and when insurers start covering this procedure.
Another question that we have is from Karen. She said she's interested in help with arthritis pain. So what treatment options or injection would you recommend?
Initially for arthritis, we would recommend starting progressively or incrementally. If it's knee osteoarthritis, we can often treat her with simple hyaluronic acid or HA, and that's an approved treatment covered by insurance. If that's not effective, or if she wants to try something in terms of biologics, then often I recommend using PRF, which is a platelet-rich fibrin with hyaluronic acid, and we've had several patients that have done well with that. If the patient has had that, and not all patients get an amazing results with PRF, although I think most of our patients do. If not, then I would go to lipogems as the next form of treatment. If we have multiple joints to inject, then I might go directly with lipogems because it's very easy to harvest a lot of fat and then basically do as many joints as we want on the same date of treatment.
Another question we have is, what are your thoughts on using stem cells for herniated discs and spinal stenosis?
So I don't treat spine. Now we have a spine doctor in the practice, Dr. Patel, who can do spinal injections. So our experience right now, or my experience with disc injections, is 0. I have never done it. If we were to do any kind of spine at this point, I think we would focus on ejecting spinal ligaments as well as facet joints. But I don't think that we would be injecting the disc at this time.
And then let's see. Mike wanted to know, he's got a knee that's got some bone-on-bone arthritis to a point that it kind of pops when he walks. He's wondering, has this gone too far, or is he a candidate maybe for one of these treatment options?
It depends on several factors. If it's really a bad bone-on-bone, regenerative is typically, I'm going to say, less likely to work. It doesn't mean that it's not going to work, but it's essentially less likely to work. If there is popping, it may be from tissues rubbing on bone spurs, or it could be the meniscus that is torn and degenerative. So ideally, we'd have to look at the knee X-ray, at the knee MRI, and then do a thorough examination to figure out where the popping is coming from, and then determine if we need to do an arthroscopy and clean out the tissue, and then proceed to regenerative treatment. But again, when you're bone on bone, I've seen patients get some benefit from regenerative, but sometimes we just have to bite the bullet and go for joint replacement.
Another question that we got is from Janet. She said she has a meniscus problem that's a little over 5 years old. She hasn't had any treatment except that she wears a knee brace whenever she's having some pain. And do you think any of the treatment options you discussed today would help her?
So we've treated many meniscus, even when they're old meniscal tears, with platelet-rich fibrin. So this is, again, it's an in-office procedure. We draw about 26 milliliters of blood, so 2 chest tubes. We spin it. We spin the blood and then obtain the product. And then under ultrasound guidance, we numb the meniscus with Novocaine and then inject the PRF, or platelet-rich fibrins, in small quantities at multiple locations to try to heal that meniscus.
And we have one last question. Jack said that his wife has arthritis in her fingers and wants to know, can this be treated with stem cell therapy?
So we can definitely treat the fingers. I would recommend doing it with lipogems or using the adipose tissue. We wouldn't have to harvest a whole lot, and we could do all her fingers on one day.
That's all of our questions.
All right. Well, I want to thank all the audience for participating. Come and see us. I don't know if the phone number is there, but just Google us. You can find Advanced Orthopedics on your browser, and call us and come in, or come in through telemedicine, and hopefully we can help you in this difficult time.